Good afternoon, everyone. Thanks for joining us today for our webinar. We are excited to have you with us today for this webinar on pathways into and out of homelessness for aging adults. This webinar is organized by the Retirement and Disability Research Center at UW-Madison. And my name is Jonathan Ferguson. I'm a financial capability specialist at the University of Wisconsin-Madison. And on the screen, you will see our agenda for today. So we have a brief welcome and intro, and then we'll move on to presentations. The first presentation will be a research overview. Um, It'll be focused on a project that's centered on our webinar's topic today. And then after that, we'll have a policy and practice implications presentation, um, followed by discussion and Q&A. To that point, please feel free throughout our session today to drop questions in the Q&A box. We will either answer those questions in the moment um, on screen or via text in the box, or we'll gather them and address them towards the end of our session during the discussion and Q&A portion. So we'll definitely do our best to get to all of your questions, either in the moment or just a little bit later in the webinar. And then, of course, after that, we'll conclude our webinar by 1 p.m. Central Time. We'll sign off there. So that's where we're headed today. I want to honor our researchers and presenters here. We've got uh, three researchers on the screen. Two of them will be here today to present and also participate in discussion. The researchers are at the top of your screen. So we have Dr. Samara Scheckler, Dr. Jennifer Molinsky, and Dr. Christopher Herbert. I will drop formal introductions in the chat so you can read through there of those researchers, and I will do the same for our policy and practice expert today, Dr. Callie Freitag. So with that, I will welcome Samara onto the screen and allow for Samara to screen share and get going with presentation.
Thank you so much, Jonathan. I'm looking forward to this conversation today. My presentation. Oh, great. Hopefully, you can see everything easily. As you said, the work that we're talking about today was produced by myself. Jen Molinsky, who's on this call, will join for the Q&A and may respond to questions in chat in an ongoing way if you have them. Our managing director, Chris Herbert, was also part of this project, and we had 3 student RAs who we enjoyed working with, John, Sad, and Kathleen. So this project was funded by the Social Security Administration, but the opinions are, of course, entirely our own. We really appreciate the support that we got from the RDRC and as we developed this work in an ongoing way, and especially the work in progress components were so useful as we tried to figure out our stories. The full paper that we produced can be found on their website. To set this the table a little bit, we are seeing more people 50 and older experiencing homelessness. Despite high rates of mortality, fully a third of those considered chronically homeless in 2020 were at least 55 years old. Meet the trends. We know that there is a broader population aging, so people who are experiencing homelessness are also aging, and in particular, there's a specific group cohort of younger baby boomers who experience higher rates of homelessness in their aging. So part of this large number of older adults who are experiencing homelessness is part of these demographic changes. We also see the drivers of housing instability that impact people in mid and late life for the first time are contributing to these trends. So in general, we know that housing instability and homelessness are driven by a lack of affordable housing, combined with income inequalities and systemic discrimination, which has left some groups, including people of color, people with disabilities, has left these people particularly vulnerable. So many describing this model have reached for the metaphor of the game with musical chairs. If chairs in the game represent affordable units of housing, and if there's not enough affordable units to accommodate the number of people with low income who need a unit of housing, then the people who are most vulnerable, such as people with disability, are likely to have a harder time competing for one of those scarce units. So these vulnerabilities, like a disability or systemic discrimination, they don't create homelessness, but they help us understand why certain people might have a harder time getting access to an affordable home because there simply just aren't enough of them. So today we're going to focus on the idea that in addition to characteristics such as disability, people who have experienced systemic discrimination and systemic discrimination, advanced age, getting older, can also be a risk factor for housing instability and experiences of homelessness because characteristics of aging do make it harder to compete for these scarce affordable housing units. In this diagram, we created two blue bubbles that suggest that age may increase the risk of housing instability and homelessness, either due to characteristics such as isolation, technology challenges, or limited mobility, or lower income that make it difficult to navigate the housing system, or age can be associated, can make it harder to deal with triggering event, such as a large rent increase, or the loss of a key support person, such as a spouse, or perhaps a change in health and ability, may be related to having a stroke or having an impactful fall. We further expect that a well-designed public benefit program, seen in that red square, could moderate the impacts of age-related changes and triggering events and help a resident maintain consistent housing through their later life. So as noted here, housing stability doesn't mean that housing doesn't ever change. Sometimes a resident might prefer to downsize. They might want to move to be closer to supports and services. But in this picture, we describe housing stability as continuous access to a safe home environment. So noted in the red box of our diagram, we expect benefit programs to be very important to older adults because especially with people experiencing homelessness and housing instability, disability rates are very high among unhoused people. Even though older adults have low approval rates for SSI and SSDI programs, and wait times for these service approvals can be very long. So we start to have some concerns about the effectiveness of the intervention programs. So we designed this research to explore age-related factors of housing insecurity and homelessness with a particular focus on the relationship between public programs and benefits use and the role in older adult housing security. We've focused on age-related differences in access to these programs and benefits and services. We relied on two sources of data for this work. First, to get a sense of trends, we obtained data, access to the Homeless Management Information System data for Massachusetts. HMIS data are usually maintained at the local level, at the COC, the Continuum of Care level, to manage client data and report it. But Massachusetts had created a rehousing data collective to compile all of this HMIS data for the entire Commonwealth. And we were the first researchers to get an opportunity to study these compiled data. So this collective was very helpful to us to facilitate. They helped us access and use and interpret these data and use them effectively. And then second, to better understand service delivery that we'll talk about in the actual implementation side of things, we interviewed providers across the Boston area continuum of care. So that includes the entire city of Boston. For this work, we mapped the landscape of organizations that particularly focused on older adult housing security throughout the COC. So not just homelessness services, but also aging services actors. And then we conducted interviews with organizations that seem to be key to these processes. So a quick note on why Boston was a great case study for our work. Boston has a very high-cost housing market. The Commonwealth, in general, Massachusetts ranked third of all states for housing unaffordability in 2022. And in 2021, almost half of residents experienced housing cost burdens, meaning they paid more than 30% of their income for housing. Massachusetts also has the 12th highest rate of homelessness among all states. But there's also a fantastic service system in Boston that moderates these difficult circumstances. So among all major US cities, Boston has a housing first approach adopted in 2015 and had the lowest rate of people sleeping outside of all major metro areas. Boston also has an organization called Hearth, which is the first organization nationwide to focus specifically on addressing the unique needs of older adults who experience homelessness. So before we dive into the findings, let me just define a few concepts to keep us on the same page. We know the definition of homelessness can vary. We're going to use HUD's framework of literal homelessness, which includes people who don't have a fixed, regular, or adequate nighttime residence. So inadequacy means that the space is unsafe or substandard, such as an abandoned building, or that it's public or otherwise not designed for someone to live in, like a bus station. An episode of homelessness ends once someone has been securely housed for a week, and people who are chronically homeless are defined by HUD to have had a series of episodes that add up to a total of 12 months unhoused. We also want to be able to talk about people who have a place to live but are struggling to maintain it. And we're going to use the term housing insecure for these folks. Housing insecurity can happen for a range of reasons. It can arise from economic problems or from a housing situation that may be a poor fit for the resident. Age is going to be key to our conversation today. And as kind of hinted at, people who live with the stress of homelessness experience chronic health conditions and mortality about 2 decades earlier than people who are housed stably. So like other researchers at the intersection of aging and homelessness, we're going to define older adults as people 50 and older because many of them are experiencing health conditions at least a couple decades in advance of their literal age. Finally, we might want to separately consider people who have chronically experienced homelessness and people who lost their housing for the first time later in life. So researchers in the Hope Home study in California found that later onset homelessness is often preceded by some amount of housing insecurity over time that tips into homelessness when the resident experiences a major disruption. And this is that triggering event that we discussed previously, such as a health event or a major rising rent. So to preview our findings, we will examine in more depth how our work showed connections between age-related experiences and later life housing insecurity. We learned that older adults experiencing housing insecurity can fall through gaps in our public program infrastructure, like an awful game of chutes and ladders. This sends them careening towards housing loss rather than climbing back into housing security, which is what we hope that the public infrastructure would offer them. And we learned that there are age-related barriers to accessing public programs and benefits that would have the potential to stabilize housing circumstances. So let's start with a quick run through some stuff we saw with our HMIS data. So using these data, the homeless management data, we confirmed that indeed older adults in Massachusetts are experiencing housing instability and homelessness, and despite fewer unhoused residents overall, the total number has gone down. The share of older Massachusetts residents experiencing homelessness has stayed stubbornly steady over recent years. You can see that orange line across the top. In 2021, older adults represented more than 3 out of 10 unhoused people statewide. We also confirmed that older adults experiencing housing insecurity were in much poorer health than their younger counterparts. In fact, well over a third of all respondents seen in the purple bars said that they were in fair or poor health. which is over twice the number of people under 50 in the orange reporting poor health conditions. We also confirmed with these data that resources change with age. Older adults in Massachusetts were less likely to report earned income, and they were generally more reliant on public benefit programs such as Social Security. So public programs and benefits are going to be very important for the economic stability and solutions that this group experiences. Now we're going to look at those age-related risk factors to housing stability. So interviews with practitioners gave us a better sense of experiences undergirding the trends that we saw. Later life housing security is particularly challenged in 3 ways. First, older adults are more vulnerable to rising rents than younger households. Their low income is heavily tied to public subsidy programs, so it's harder for them to keep up with market rate housing prices when they're dependent on public programs. As one interviewee explained, housing prices are rising. Older adults have lived in their homes for decades, and all of a sudden, a landlord realizes the apartment is worth more and hits the tenants with a drastic increase. Additionally, public subsidy programs aren't keeping up with these rising market rates. So the increase in Social Security or other benefit programs are not matching the speed of cost increases experienced by renters. So people just don't have enough funds to make it work. And with rental assistance in short supply, only about 1 in 4 eligible households actually receive a housing subsidy to bring costs down to affordable levels for their budgets. Older adults are also more likely to need accessible housing, as noted by the large number of unhoused people who said that they were living with poor health. The current resident can become inadequate if the resident has a functional limitation. So one interviewee explained that like most places, a lot of older buildings in Boston don't have an elevator and they're not wheelchair accessible. So the options for affordable housing can be really restricted for these residents places, the very few places that have accessibility. Finally, older adults are more likely to need daily assistance, but without a residence, it's very difficult for them to access the services they need. Many rely on a family friend or a family member or a neighbor for assistance, but it's common for isolation to increase with age. One interviewee, when talking about the population they served, said that residents who are formerly homeless have often severed family ties. It's more the norm than the aberration, said this person. If they have family, the family is located elsewhere. And this person spoke for the organization, saying sometimes their best successes are when they're able to reunite family members as a long-term housing solution. Another interviewee explained how this lack of family assistance threatens housing security, pointing out that without a family member to move in with, residents are staying in their home as long as they can. And most of the time, what drives them out of that home is that they just can't manage it any longer. They can't manage their apartment. They can't manage all of their medical needs. They can't get from the bed to the bathroom. And they just can't stay in the apartment any longer without more support. So we produced this chart to try to contextualize these findings and create a framework to discuss the relationship of age and housing security. So the gray column on the left lists numerous individual factors that are related to the risk of homelessness, and many of these are well studied. So for instance, across the middle row, we know that there's a relationship between physical disability, cognitive impairments, and chronic health conditions, and experiences of housing instability and homelessness. Then you see on the right in the orange column, we noted that there are some macro policy areas that limit the impact of some of these risk factors and improve housing stability for folks. Using our health and ability example that we just talked about, access to good health care, long-term services and supports, accessible housing, and reliable public transportation might reduce some of the risk of housing insecurity related to these physical disabilities. So our contribution of this paper is represented in the blue column in the middle. These are specific aging-related factors that are related to the gray column and compound those risks of housing insecurity. So again, using the example of health and ability, many people experience late life changes in their cognition and their health and their functional ability, and these changes can destabilize their housing. Other age-related risks include a diminished support network, limited earnings capacity, and the cumulative impacts of multiple disparities that someone has experienced over time. Ultimately, we're going to use this diagram to suggest that age can compound the individual experiences and leave a resident more reliant on those macro level resources, those orange resources and policies to keep housing secure and stable over time. So now we're going to look at specific age-related experiences in accessing services and supports. So during our interviews, we learned that there are many ways that systemic problems and gaps reduce the effectiveness of public programs that are intended to improve housing stability. Our interviewees
Hey,
emphasize that,
Samara,
yes,
I'm sorry to interrupt.
sure,
My apologies. We're getting off and on feedback from maybe your mic, so I don't know if there's anything that can be
sure.
done
Let me,
to correct that. But
I'm
anyway,
going
I
to try
just thought I'd
unmuting.
let you know.
Does that sound okay?
Yeah, it sounds clear now. It's just been off
Okay.
and on, so I assume it'll fix itself now.
All right, fingers crossed. Let me know if we need to keep adjusting. Um, okay, so let's talk about the public programs and their effectiveness. So our interviewees talked about how it was almost always more efficient to help a person remain housed than to find a new place for them to live. But a lot of programs and services are not available until a need emerges or until a crisis has happened. So long wait times for affordable housing, wait times for benefits and services, these all increased housing vulnerabilities, even though the purpose was prioritizing residents for housing who were most vulnerable, it wasn't always efficient when it was letting other residents fall into these crisis circumstances. So for instance, one interviewee described a woman with severely compromised mobility who qualified for SSDI after an application appeal. But in the process of going through the application and appeal, she lost her housing because she didn't have income while that application was being reviewed. Similarly, there are few resources available to fund home modification, especially for renters. And residents struggled who lived in unsafe or inaccessible conditions while they waited maybe for approval and installation of items like a ramp or a grab bar. One person described how getting a ramp becomes a 3-month process of waiting for approval and appealing denials. In the end, this provider said there's not even enough money approved to do the modification properly. So it ends up being an unnecessary waiting game. One interview described a client who lived in a 4th floor walk-up who had to scoot up and down the stairs on her bottom. Wasn't prioritized for housing assistance because she was living with a roof over her head. But obviously she was not in a safe situation for her. This is an example of also how program rules and exclusions can limit housing options, right? So the rules are trying to prioritize people without a roof. This woman had a roof, but it wasn't a safe situation for her. Rules can also limit the ability of an older adult to get help from their family. There are subsidized residents, for example, many that limit longer stay visitors, but this can prevent an older person from staying with a relative while they were recovering from health event without jeopardizing their family member's lease. Or if the older adult is the leaseholder, the housing will make it harder for them to have someone come in and stay with them to help. So another interviewee described a client who lived in subsidized housing and needed 24-hour care, 24-hour day in, day out care from their family. But problems kept arising because the property manager really didn't understand what it would look like, what it takes to have a family that's caring for someone 24 hours a day. And they're getting these violations for having multiple people in the apartment and having people coming in and out of the house at odd hours. Um, just not understanding what total care actually looks like. Um, Exclusions also make it difficult for people with circumstances such as criminal records or whose immigration status is misaligned with housing rules. These exclusions can artificially restrict housing options for older adults. Actually, options are extremely limited for older low-income people, and the more the needs are, the more complicated the situation, the harder it is to meet those needs. One interviewee talked about the challenges of being needs for someone who needed support, but not nursing home level care. She said that for people to spend the night in the shelter, you have to be able to take a shower by yourself. You have to be able to go to the bathroom by yourself and feed yourself, to get in and out of bed on your own. She's like, we don't have home health aides on site, but also they don't have a place to send someone who needs a small amount of assistance, but perhaps not nursing home level care. So people who need this kind of help can find themselves stuck outside the homelessness services system. It's also important to acknowledge that age-related experiences can make it harder for older adults to access the benefits that they need. Application processes can be really difficult for anyone to navigate without information about affordable housing availability. Applicants don't have insight about where success is more likely, and how to complete long and detailed applications for every subsidy program. Process can be really burdensome for older adults who are likely to have transportation problems, have very low income, might have technology access challenges. By late, like, who might have lost track of documents like birth certificates, or the document itself integrated or expired. Also, people often experience age-related communication challenges relating to cognitive changes, hearing loss, or sight loss. And by late life, most low-income adults many adults have experienced trauma-related attention differences because housing instability, verging on housing instability, extreme poverty, and violence are traumatic experiences that complicate someone's ability to make these applications happen. And as one person explains, these cognitive issues are a symptom of trauma. It becomes hard to pay attention to the details of an application, hard to understand. People stop trusting government services because in the past they've had issues when a program got shut down. Another framed the difficulties around the stress of housing insecurity, saying you're just trying to find out where you're going to stay tonight that's warm. You're not thinking, let me go to the library and log into my account to see if they need another document. So we'll finish the conversation by lifting up a couple opportunities to help older adults. So first, older adults particularly benefit from reduced wait times for services during application processing periods. As an example, a participant pointed to the efficient design of the Massachusetts Medicaid program that presumes eligibility, begins services immediately while the application is being processed to ensure that the person doesn't lose ground while they're waiting for the administrative process to resolve. Interviewees also advocated for reduced demands on older participants by simplifying the application processes, such as programs sharing documentation or information through a repository or a universal application that assesses eligibility simultaneously for multiple programs. So we noticed that applications that are clear, concise, and use a friendly tone are easier for older applicants and can feel less threatening. Also, low barrier services are a cornerstone of trust building for this population. As participants observed, older adults often contact the program for a very specific reason, like access to meal services. But as they develop familiarity, they might begin to accept other types of help. So a program without a complex application can serve to build a relationship and introduce a participant to other needed resources. But at root, Prevention is key. So continual and expanded connection to services, such as case management, can establish this trust and help intervene before housing becomes jeopardized. As an example, multiple interviewees talked about older adults losing their housing due to hoarding. Boston has services to help address these types of living conditions, but these services might feel very invasive for an older adult, and that person might refuse such intimate assistance unless there's a warm hand from a provider that they trust. In addition to continuity, there are relatively small dollar assistance can help avert housing crisis. So, for example, one person described an organization that steps in to pay rent while an older adult in a hospital or rehab center, so that person has a home to be discharged to. Home modifications and services assistance are also examples of relatively smaller programs that keep someone housed. That said, some people are already unhoused or don't live in a home that can be saved, and these people need a wide range of affordable options that fit their unique needs, specific abilities, specific preferences. So smaller spaces, such as single room occupancy or housing that includes services and supports, will be very valuable to them. Affordable housing needs to be connected to community infrastructure, such as transportation, grocery stores, and pharmacies, and properties and program rules that exclude certain groups need to be carefully considered for their other impacts. Just most foundationally, we need more housing that people can afford to live in, benefit programs that align with the low cost of living, and accessible, affordable, and stable housing that is centrally located. I'm eager to hear Dr. Freitag bring additional context to the conversation, and I'll finish with a last quote from one of our interviewees, who said that when you're homeless or about to become homeless, it's one of the worst feelings in the world, a person not knowing where they're going to lay their head to be safe and sound.
Thank you so much, Samara. That was great. We learned a lot. Thank you, everyone who's helped through with audio difficulties. I think a lot of us still got a lot out of that. So I'm Dr. Callie Freitag, and what I'm going to do is go through a case example, first of all, of some advocacy from my past life prior to me being an academic. That intervened right in the prevention space. And an example of what Samara was just talking about, a type of intervention that was a low barrier to entry to provide resources to help keep people housed. And then we'll move into a facilitated question and answer. I see already there's some questions in the chat. Some are getting answered in the Q&A, and then some I've flagged that I'll then lead with, and we can talk live about that. So just 5 minutes from me, and then we'll kind of go into a Q&A. So I'm Callie Freitag. I'm an assistant professor at UW-Madison, and my research focuses broadly on policies relating to aging, disability, and poverty. But before I came to academia, I was a policy analyst and advocate in Sacramento, California, where I worked mostly on aging and long-term care issues. And California is notable for and well known for having a relatively generous safety net, expansive in-home care services, expanded Medicaid policies, paid family leave, generally a pretty expansive safety net. But California is also known for having really high cost of living, resulting in high rates of homelessness. So when I was an advocate in California, I worked for the organization you see listed there, the County Welfare Directors Association, CWDA. And that association, it's important to understand the makeup of it. California had 58 counties, or has 58 counties. And just like the federal government devolves social service management down to the states, California, with its many counties, devolves social service management from the state to the counties. And there's a similar relationship like the federal government has with the states. So all 58 county social services directors were represented by this one association, CWDA, that I worked for. And the way that it worked, and kind of where I came in as someone who worked for the association, is that we would have monthly meetings with different representatives from different programs managed at the county level. And I covered, in part, adult protective services. So when we were gearing up for the legislative and budget cycle one season, social workers came to us from adult protective services, and they said, you know what, something we're noticing is that a lot of our clients are at risk of eviction or are unstably housed or unsafely housed, kind of all of the things that Samara was talking about in her presentation happening on the other side of the country. But APS social workers were saying, we can't do anything about it. We don't have any funds. We can't even do intensive case management. APS social workers are those who go and do welfare checks, who can help act as an intermediary between, say, people who are experiencing financial abuse and law enforcement. APS also responds to reports of self-neglect. So people say with cognitive impairments who are living in hoarding situations, that would be classified as self-neglect because adults are responsible for themselves, at least until they're deemed not to have capacity by the courts. So to make a long story long, APS social workers came to us and said, we want to do something to prevent homelessness amongst the people we serve, but we don't have the money to do it. So I at CWDA, with the power of that pretty powerful organization, along with other elder justice or aging focused organizations, we created this proposal called Home Safe. That was a flexible homelessness prevention fund for people served by adult protective services. So survivors of adult or of older adult abuse and neglect. And we had broad support from counties. We had support from all sorts of organizations. It was a pretty popular program. I wish I couldn't find my sign-on letter from when we did this, but I had a beautiful letter full of logos of organizations and counties and governments that saw the need for this program and signed on. So I'll tell you a bit about this proposal. And I'm going through all this detail because advocacy is something that anyone can do. And it's easier to do advocacy when you're aligned with certain organizations. I was in a pretty powerful space where we were representing county governments, which had a lot of sway at that time and still in the California state legislature. But we were partnering with organizations across the state. And so wherever you find yourself sitting, you may not have a CWDA type organization in your state, but there are probably advocacy organizations with certain types of power, or if they don't exist, you can build them to build power and do this type of advocacy. So specifically what we had asked for was $15 million from the state general fund each year for a 3-year pilot program. And what we did is we required counties to match. So counties would, in the pilot program version of this, they would apply for funding and then be required to put in a dollar for dollar match for that type of funding. And then the program was basically this pot of money that county adult protective services programs could use, and there's rules in the state statute and then also in regulation and then set by counties themselves about what the money could be spent on. But broadly, it was allowed to be used to prevent homelessness or help house people who were served by adult protective services. So this included paying for cleaners, paying for ramps, helping people move and get that sort of transition assistance. I don't have like a full example of how it was all moved. I think one proposal was buying someone a trailer to live on land that they had. So there were all sorts of, and I'm not sure if that got approved or not, but it was the whole purpose of it was to have flexible funds that didn't need a lengthy approval process. And the pilot was successful. Since 2021, Home Safe, the program, we called it Home Safe, has operated in all the counties and in 23 tribes in California. And the funding now has grown. So the state appropriated $92.5 million funds in 2021 and also this $92.5 million in 2022. And from reading the legislation, it seems like, because I'm no longer in California, but it seems like that was more than enough money to be extended and be reappropriated, meaning counties can continue to spend that those funds through 2026. And I imagine this is just kind of a trend in social legislation right now where temporary programs are very popular to give decision makers an out if they want to cut it. But it seems like a popular program, and I imagine in 2026, there will be some version, or there'll definitely be advocacy efforts to keep it going. And I imagine that there will be some version of this program that will continue going forward. Okay, so that's just one example of work that I helped do in California. And so now I'm gonna stop sharing my slides and invite Samara and Jen back on to do a little facilitated Q&A. So I have some of my own questions. You in the audience, you may have some of your questions. I'm gonna ask first the two questions that we have in the Q&A. Audience, please type it in there if you have questions, but I can kind of keep the conversation going as you think. Okay. Hi, Jen. Do you want to introduce yourself since this is the first time you're on this?
Lovely to be here. Jen Molinsky from the Joint Center. And yeah, I can take any of the questions. I've had a little more time to think about them than Samara did.
Yeah, well, sure.
Yeah, in terms of the English proficiency, absolutely. This is something that came up again and again in the interviews that we conducted, speaking to the challenges that older adults experienced who had limited proficiency, written or speaking, in terms of accessing information, filling out forms. And I think it seemed, and Samara, you can embellish here, but I think every time we heard that, we also heard this intersection with technology, the challenges of using technology, the comfort with it, the access to it, and then even the access to decent technology, not outdated phones or what have you. I think during COVID, more and more moved online, which was just, helpful in so many ways, but for older adults, that really created some challenges in terms of this access to information, and the language compounded that.
I love that point, Jen, about the access to technology. And the other thing this brings up to me is the critical role of contact with some kind of service system expert to help folks navigate the system itself with all of their various barriers. I remember one provider talking about working with a sizable community of folks in Boston who were Haitian Creole speakers. And this made applications very difficult because these applicants were not formally educated in that language. The Creole language was a spoken language, and it's not actually what they learned in school. So written, like, complex bureaucratic language, even if translated, wasn't going to be terribly accessible to them because it didn't align with the language that they spoke at home. So having somebody to be that intermediary was really critical.
Well, and I want to jump in and say this is consistent with some research that I've done on the role of trust in older adults accessing social services. So you had mentioned this, it being very important. Some research that I've done, we interviewed aging service providers in the wake of COVID, and it was the long established, long trusted organizations, not the random efforts that sprung up, but like the long established organizations that often were serving a culturally specific group of adults that were the hub for people to get access to groceries and that sort of thing. And I imagine that's similar that you saw. Yeah. Okay, pivoting a little bit to, we have a question from Farah Edwards, who sent us some links about algorithmic pricing that multifamily landlords are participating in. And Farah says regular consumers are basically facing a monopoly in a lopsided market where they don't have an opportunity to push back on pricing. Do we know if there's any way to mitigate this for our clients, or is there any pending legislation?
So we have not researched this, but I did recently see that there is a new Preventing Algorithmic Collusion Act that was introduced by Senator Klobuchar and co-sponsored by 8 other Senate Democrats. So it is clearly something that's very much, gaining attention. I would just say that the sort of larger issue that is a part of is tenant protection, and how important tenant protections in general have been to this housing stability. And I guess, sitting here in the Boston area, I would want to call out the great work that the city of Somerville has done, not Boston to Cambridge, it's their offices of housing stability around the, but I happen to know a little bit more about Somerville, and they focus on helping individuals. So they will field calls from older adults saying that they need an accessible, all the things that Samara talked about. But they're also engaged in efforts to build the city's supply of affordable housing, thinking about things like condo conversions and getting ahead of those, and buildings flipping, and the eviction of longtime tenants because the rent has gone up so astronomically. But they're also, and this is the point I think I really want to make, is that they're seeking to build a much more tenant and landlord literacy around tenants' rights. And if you go to their website, and I can put it in the chat, there's information available in multiple languages, and they have passed a requirement that tenants receive this information upon the beginning of their tenancy and exiting their tenancy. So I think they're doing a lot to try to increase the education around what is, allowed and appropriate behavior. It doesn't get to the algorithmic thing, I admit, but it's part of that story.
I really appreciate that, Jen, and I want to build on your point about advocacy and also bring in to the conversation the organizations in our area who we talked to that help bring together vulnerable tenants, low-income tenants who are in danger potentially of losing their homes because maybe their building is being sold, or there's some large change happening in a building where there's a number of people who live. There are organizations that have reach out to these tenants and help them organize themselves to see if they can be the purchaser of the building, or to see if there is a local nonprofit that can purchase the building and rent the units affordably back to the current tenants. So there definitely is also a role for the local advocacy community in that pricing conversation.
Absolutely. And I'll just say for those who live really anywhere, if you Google tenants union and your city, you may be able to find some efforts there. I know I'm in Madison, and Madison has at least 2 tenants unions that are pretty active. So seeing no other audience Q&As right now, I want to just take a step back and ask some bigger picture questions of both of you. So one thing I think a lot about, and this is the academic, not the policy person in me, is, and it's the social worker in me, that the way we're trained is, and the way I think about the safety net, is that older adults have long been considered the deserving poor. And what is mean and how that statement's justified is that older folks, and I'm thinking particularly of people 65 and above, benefit from Social Security, benefit from Medicare, have easier pathways onto other benefits like SNAP, SSI, and subsidized housing. And so my observation, and I'm wondering if you could reflect on this, is that the fact that older folks benefit this much, or like are structurally designed to benefit more from the safety net than younger folks, but homelessness persists, is pretty striking. And I'm wondering if you could kind of reflect on that duality.
Or do you want to start?
Yeah, I was just thinking about while you were talking, Callie. It's interesting. I think one of the things that we have to keep in mind is that, and this kind of this insight I think comes very much out of some research from California, the Benioff Institute, and some of the work that they did surveying people experiencing homelessness, huge survey where they really were able to talk to people and learn about how people became homeless. And or lost their homes. And I think what they heard over and over again is that people who became homeless later in life were often living on the margins for a long time first, right? So it's not, while people may have been employed, they may have been active participants in society, they also were struggling to make ends meet for a long time, right? And before they actually met this, late life experience where now their health status changed or their income went down because they could no longer work, and the pieces no longer fit together, even though we do have a safety net system that does often prioritize older adults. Often with these compounded circumstances, it's just not going to be enough for people who really have been trying and struggling their whole lives, but are just always on the verge of falling into a crisis.
I would, yeah, exactly what you said, Samara. I would say that we have this safety net, and in some ways, older adults are better served. So a third of older adults, or just a bit more than a third, who are eligible for housing assistance get it. I think that that's 25% for families who are eligible for housing assistance, but that's still 2/3 who don't get it. So we have a pretty incomplete safety net system. I would also say the safety net system is not knitted together well. I mean, I think that was one of the major themes of this report was, just because you qualify for one thing doesn't mean you qualify for another thing, or nor have you completed the 90 applications you might need to find housing if you qualify for SNAP. So that I think is a big thing. I think there's a notion too of cumulative disadvantage, that older adults, being older, have experienced a lot of things in their lives, and they're not just one-offs, that they sort of work with each other to create different trajectories. And by older life, people have just vastly different resources and vastly different experiences. And I think the last challenge is just that older adults who have experienced homelessness, rehousing and finding supports, it may not end there, because with age, needs can grow. So it's not getting someone back on their feet so that they can go back to a job. It may be getting them, housed and stable, but also anticipating more needs to come in terms of needing assistance with daily living or whatnot. So I think for all those reasons, it's a particularly complicated and we see it growing. It's definitely a growing trend.
Add to that point, Jen, too, a lot of times I think our safety net system has this framework of getting someone stable, and then the system moves away, right? The person lives in their stable way. Whereas when we're talking about this older population, we can expect that actually their needs are going to compound and increase over time, and new needs are going to arise. So this framework of like coming in, fixing something, leaving, is going to end up being costly, because a new connection is going to be made every time a new need arises. And likely the intervention is going to be like a little bit too late or a little bit later than it could have been if a connection was just maintained over time.
Absolutely. I appreciate that. And I feel like you've hit on several points that I was going to ask about. So I'm really glad about that. The other really big picture thing I wanted to talk about is the relationship between aging and disability. Again, this is something I think about a lot. They're not synonymous, right? But they are related. The probability of becoming disabled in one way or another increases as one ages. And I wanted to bring that into context with my sort of age and like the age gradation of the safety net question, because before age 65 or before 62 for Social Security, if you need access to income supports, you usually have to prove to the Social Security Administration that you have a disability that meets their definition. And I'm really struck by the story that you told of the woman who lost housing while she was going through that process. And so I'm wondering if you did a nice job in your presentation of talking about the ways in which age and disability are distinct, but I'm wondering if you can talk about what how disability is ingrained in your conception of aging and the policy barriers.
I think it's such an important and like interesting question too, right? In part because we often have a very disability focused view of the aging experience, right? As you know, one of the key things that we often talk about are the losses that happen in late life. So, you know, there are a couple ways that I think we could actually flip that conversation a little bit and think about um, some of the advantages that people have by late life, especially if they have the opportunity to age in the community of their preference. So often people have like an intimate knowledge and deep like embeddedness in their community that can be a huge advantage. You know, while we do see isolation increasing for people, some people, we also see that some people become cornerstones, you know, of their community, like they're culture keepers and the volunteers and the, you know, people who are just very like deeply a part of the community network. And that's actually good for the community and it's good for them, right? And I think it's you know, it's important to remember that. And um the other thing that I want to point out in this like enabling framework is that the right resources can mitigate some of these disability experiences, right? If the house is well designed and well fit to the resident, then what we see as disability doesn't, you know, someone can act more independently, right? If they can use their home independently, they can be more independent when transportation systems meet their needs. They can, you know, be more independent when they have access to services without significant you know, other barriers. So I would say that, you know, it's important to think about these service systems not as like disability services, but like as enabling factors that actually bring down the cost of people living in community because they don't necessarily need one-on-one care to do their laundry because it, you know, the laundry machine is like accessible to them in their kitchen or whatever.
I appreciate that so much because I think what you're touching on is ideas from the disability rights and disability justice movement, the idea that disability itself is socially constructed, and the social model of disability argues that people aren't disabled, they have impairments like physically or mentally, but then it's the social world, the world as constructed, being inaccessible, that is disabling. So I appreciate that as well. Learning that, you know, rocked my world. So I always try and tell people about the social model of disability when I can. With our last 2 minutes, I did want to take a second and just acknowledge that the Retirement and Disability Research Consortium from Social Security Administration, which funded your work, it's funded my work in the past, and it's funding this webinar, was eliminated a few weeks ago. That the funding has been cut, and now programs like this webinar, the research that you do, that I've done, will no longer be funded. And I'm wondering if you could have a moment to talk about what this funding meant for your work.
This funding enabled us to elevate an issue that's that was barely, that was, I mean, I guess start again. I see this project as learning from practice, learning from the practitioners out there, that a lot of what we uncovered, I don't think would surprise any of the frontline workers, but we wanted to elevate that and to tell the stories of what is happening on the ground, because the whole story of older adults experiencing homelessness has been somewhat anecdotal. There's been, you know, a few studies, and then recently the California study was a big one. There's, you know, a few researchers out there who are looking at this, but even until recently, the point in time counts weren't specifically looking at, you know, age in that way. You know, if you were over 25, you were, so it was really hard to tell the story. And I think it's such an important story, and we need to think about how we can support older people, this growing population, which I can't, unfortunately, I'm not optimistic about the trends just in terms of housing affordability, the growing older population, the sort of loss of the home ownership rate has been going down among older. I mean, we have every reason to believe that this is a challenge that's going to be with us for a while. And so to be able to bring that story and to think about what policies that we need to support the frontline workers and to support this population was just really important to us.
I know we're at time, but I just want to add really quick how hard it is to study these hidden populations, right? These populations that are very they have high needs, they have high vulnerabilities, and they are difficult to access. And having the resources of this consortium really gave us the ability to do the slow and difficult work of trying to untangle the story. Not to mention the consortium's resources of other researchers to help us think through our findings and interpret them, in the most effective ways that we can.
And just to that point, the structure of this, having the chance to touch base with researchers along the way as we developed the project and worked it through was really an important part.
Well, thank you for that. I really appreciate your work. I think Jonathan is here to close us out.
I am. Thank you all so much for your time today and sharing everything that you did and this very heartfelt and informative conversation you all have had on the back end. It's truly appreciated. And of course, I also want to thank our attendees for joining and spending their valuable time with us to learn about this important subject. And hopefully we'll all, with this, continue our work in learning to improve upon the current situation, as Jennifer mentioned, is likely to continue based off all the indicators that we have. Otherwise, I want to wish everyone a great day and hopefully see you sometime soon. All right. Bye-bye, y'all.
Thank you.